Hey everyone, welcome to my channel True to the Code. This is my first video, and today I'll be teaching ulnar claw hand and the test related to the ulnar nerve. Hope you like it. Hi everyone, so let's begin with the topic ulnar claw hand and test of the ulnar nerve. So before we actually go to the topic proper, first we need to review some basics of the ulnar nerve. And the basics we need to review before actually going into the topic proper are: 1. The root value and the important relations of the ulnar nerve. 2. The muscles supplied by the ulnar nerve. 3. The actions of the muscles supplied. 4. The sensory distribution. And 5. The autonomous distribution. Let's talk about the root value and the important relations of the ulnar nerve. So, the ulnar nerve arises from the C8 to T1 roots of the brachial plexus. And some of the important relations we need to remember of the ulnar nerve are: first, in the arm. In the arm, we need to remember that it is closely related to the brachial artery, and its relation to the brachial artery is that it is medial to the brachial artery. So basically, it lies medial to the brachial artery, and at the junction of the medial intermuscular septum, it comes to lie in the posterior compartment, and as it approaches the elbow, it becomes more and more superficial, and it comes to lie behind the medial epicondyle of the elbow. This is in the area of the elbow. After crossing the elbow, let's talk about its course in the forearm. In the forearm, the most important relation is that it enters the forearm between the two heads of the flexor carpi ulnaris. So this is the important relation, flexor carpi ulnaris. Now we come to the wrist. In the wrist, it actually passes through the Guyon's canal, which is the most important relation of the ulnar nerve in the wrist. Guyon's canal is actually a fibro-osseous canal, which is present between the pisiform bone and the hook of the hamate. So, as you can see here, this is the Guyon's canal. And in the wrist area, the ulnar nerve passes through the Guyon's canal before actually supplying the muscles of the wrist. I mean, the muscles of the hand. So wrist, it passes through the Guyon's canal. That's the most important relation in the wrist. So now we'll talk about the muscles supplied by the ulnar nerve during its course. So first, we talked about its course in the arm, and in the arm, it supplies no muscles. So in the arm, it's nil. Now, when we come to the forearm, as you can see from the diagram, the muscles supplied by the ulnar nerve are the flexor carpi ulnaris muscle and the flexor digitorum profundus muscle. Now, the flexor digitorum profundus muscle, it is supplied by both the median nerve and the ulnar nerve. So, when you talk about the ulnar nerve supply, it supplies the medial half of the flexor digitorum profundus. That is something we must remember, because the lateral half of the flexor digitorum profundus is supplied by the ulnar nerve. So so once again, it's in the forearm, it's flexor carpi ulnaris muscle and the medial half of the flexor digitorum profundus muscle. Now, after the forearm, it supplies muscles of the hand, and in the hand, it supplies the following muscles. It supplies the abductor digiti minimi, it supplies the adductor pollicis muscles, it supplies the intraosseous muscles, which is both the palmar and the dorsal introssei. There are 4 introssei in the hand, and all the introssei, both the palmar and the dorsal introssei muscles are supplied by the ulnar nerve. And then it supplies the lumbricals. Again, we have 4 lumbricals in the hand, and the ulnar nerve supplies the medial 2 lumbricals. Okay, now we'll talk about the action of the muscles supplied by the ulnar nerve. First, the flexor carpi ulnaris muscle. The action of the flexor carpi ulnaris muscle is basically flexion along with adduction. Next muscle supplied by the ulnar nerve in the forearm is the abductor digiti minimi. And the action of the abductor digiti minimi is, it's there in the name, it's abduction of the little finger, as the name suggests. Now we'll talk about the muscles supplied in the hand. The muscles supplied in the hand include the interossei muscle, the action of the interossei muscle is basically adduction and abduction. So now we said that there are two interossei, the palmar interossei and the dorsal interossei. Now a mnemonic, a really common mnemonic to remember the action of the interossei muscle is pad and dab. So basically the palmar interossei, they do the function of adduction, and the dorsal interossei, they do the function of abduction. So palmar interossei, adduction. Dorsal interossei, abduction. Now we'll talk about the lumbricals. The action of the lumbricals is flexion at the metacarpophalangeal joints and extension at the interphalangeal joints. Now we'll talk about the action of the adductor pollicis muscle. Now the action of this muscle is in the name. So what it does is it adducts the thumb, because the word pollicis means thumb, and since this is the adductor pollicis, it adducts the thumb. Now one muscle which I missed out, which is a muscle of the forearm, is the flexor digitorum profundus. And like I said before, the ulnar nerve, it supplies the medial half of the flexor digitorum profundus. And the action of the flexor digitorum profundus is the flexion of the distal interphalangeal joints. And this becomes important in claw hand, which we'll see further down the video. The sensory distribution of the ulnar nerve, basically the ulnar nerve supplies the medial 1.5 fingers, both in the palmar aspect as well as in the dorsal aspect. So this diagram will help us to talk about the palmar branch of the ulnar nerve in the forearm, the superficial branch of the ulnar nerve, and then you have the dorsal branch of the ulnar nerve from the forearm. So that's so like I said, basically it's the medial 1.5 fingers. This is something we must remember at all times. Medial 1.5 fingers is a sensitive distribution of the ulnar nerve, and this goes for both the palmar as well as the dorsal aspect of the palm. Now, autonomous distribution. So what does the term autonomous distribution mean? Autonomous distribution is the area exclusively supplied by that one nerve, and in this case exclusively supplied by the ulnar nerve. So okay, the autonomous distribution of the ulnar nerve is the distal phalanx of the little finger in both the palmar aspect as well as the dorsal aspect, and this is what we can see from the diagram. This orange color shows the autonomous distribution of the ulnar nerve. Now we'll come to the topic proper, which is the ulnar claw hand. So basically we'll first talk about the definition of the ulnar claw hand. So what is a claw hand? So basically what leads to claw hand deformity is the hyperextension at the metacarpophalangeal joints and the flexion of the interphalangeal joints. And this is something you have to commit to memory. Hyperextension of the metacarpophalangeal joints, which I think it's easier when one can remember the diagram. So from the diagram, remember what an ulnar claw hand looks like. And with that, we can easily come up with the definition. That is hyperextension at the metacarpophalangeal joints and the flexion of the interphalangeal joints. As shown in the diagram here, you see the flexion of the interphalangeal joints, and then you see a hyperextension of the metacarpophalangeal joints. What causes an ulnar claw hand? The cause of an ulnar claw hand is the paralysis of the ulnar nerve. Now, there are two types of ulnar nerve palsy. You have the high ulnar nerve palsy, and then you have the low ulnar nerve palsy. So basically, what is the high ulnar nerve palsy and what is the low ulnar nerve palsy? High ulnar nerve palsy is basically the injury proximal to the elbow. Now, what happens when you have an injury proximal to the elbow? So, when you have an injury proximal to the elbow, the muscles supplied by the ulnar nerve in both the forearm as well as the hand get paralyzed. And what happens in a low ulnar nerve palsy? In a low ulnar nerve palsy, the injury occurs in the distal third of the forearm. So, what happens is only the muscles of the hand are paralyzed. And this phenomenon, this concept is what leads us to the phenomenon of the ulnar paradox. So, in ulnar paradox, the higher the injury, the lower the deformity, and vice versa. So this is something you have to commit to memory. I mean, if someone asks you what an ulnar paradox is, this is what you need to remember. Higher the injury, lower the deformity, and vice versa. That means lower the injury, higher the deformity. And why does this occur? Basically, it occurs because when the injury is higher, like we said over here, the forearm and the hands are paralyzed. So what happens is the flexor digitorum profundus is also injured. What is the action of the flexor digitorum profundus? The flexor digitorum profundus basically causes flexion of the interphalangeal joints, especially in the terminal phalanx. So and this is what happens in the claw hand. So when the flexor digitorum profundus is injured, you will not have the flexion of the interphalangeal joints, and therefore there is less deformity when there is a higher injury. Whereas when there is a lower injury, which occurs in the distal one third of the forearm, the hand is paralyzed and the flexor digitorum profundus is spared, and hence, like we said for the claw hand, since the flexor digitorum profundus is spared, there can be flexion of the interphalangeal joint, causing more clawing of the hand. So this is the ulnar paradox. Now we'll talk about the tests of the ulnar nerve. Right, so now we'll be continuing our discussion on the tests of the ulnar nerve, and since this requires a demonstration, I will be demonstrating. The first muscle I'll be demonstrating is the flexor carpi ulnaris muscle. So how do we test the flexor carpi ulnaris muscle? So like I said, the action of the flexor carpi ulnaris is basically flexion and adduction. The action of the flexor carpi ulnaris is to flex and then to adduct. And when we adduct, we can easily feel the flexor carpi ulnaris muscle in this area. the tendon of the flexor carpi ulnaris can be felt here. But if the flexor carpi ulnaris tendon is paralyzed, you end up having a radial deviation to the opposite side. The second muscle to be tested is the abductor digiti minimi. So basically, how do we test the abductor digiti minimi? So keep your hand firmly on the table and then apply resistance to the little finger over here, and then ask the patient to abduct the little finger while applying resistance. And when we abduct the little finger against resistance, you can feel the tendon of the abductor digiti minimi over here. So that's the abductor digiti minimi test. Then we'll be testing the intraossei muscle. The intraossei muscle, like I said, you have the palmar intraossei as well as the dorsal intraossei. Now, the palmar intraossei, the action is adduction. Like I said, pad and dab. Palmar intraossei, adduction. Dorsal intraossei, abduction. So first, we'll talk about the palmar intraossei muscle. The test for the palmar intraossei muscle is called the card test. So how do we do the card test? So basically, imagine this is a card. Right. So what we ask the patient to do is hold the card between the index finger and the middle finger, and then if the patient is right hand dominant, you're supposed to ask the patient to hold the card with the dominant hand. So suppose the patient is right hand dominant. Now as a clinician, you are supposed to use your dominant hand and the same two fingers, the second finger and the third finger, and pull the card away, try to pull the card away from the patient with equal force. Now, the same dominant hand and the same two fingers are used so that there are no unequal forces being acting. And this helps to test the strength of the palmar intraossei muscle. Now, the dorsal intraossei muscle. How to test the dorsal intraossei muscle? The dorsal intraossei muscle, like I said, does abduction. So, ask the patient to keep his hand firmly on the table, and the middle finger is used to abduct to either finger of the adjacent side. And this is called a GAVA test. And make sure that you don't ask the patient to slide like this. You're actually supposed to ask the patient to raise the middle finger and then touch the adjacent fingers, right? So this is how you do the GAVA test, which is used to test the dorsal intraossei muscle for abduction. Another muscle, as you would recall, is the lumbricals, but the separate action of the lumbricals cannot actually be tested. The next muscle to be tested is the adductor pollicis muscle. Now, to test the adductor pollicis muscle, we do the book test, which is also called the Fromm's sign, and this is how it's tested. So basically, imagine this is a book. Ask the patient to hold the book between the thumb and the index finger like this, and then you should pull the book from the opposite side to test the strength of the muscles. Usually the patient holds the book with the strength of the adductor pollicis muscle as well as the first intraossei muscle. But in a patient who has a paralyzed ulnar nerve, the adductor pollicis obviously is not innervated, and thereby what happens is the patient ends up flexing the thumb in order to hold the book properly, that is, in order to grasp the book properly. And in doing so, the patient is actually using the patient's flexor pollicis longus muscle to grasp the book instead of the adductor pollicis. And this is called the Fromm's sign or the book test. So that's all the tests of the ulnar nerve. If you made it till the end of this video, thank you so much for watching. I really hope this whole thing was really comprehensible and easy to understand, because that was the whole point of the video. Since this is my first video out here, I would really appreciate any constructive criticism that you might have to add, any opinions, any new topics you want me to teach if you thought this was good. So yeah, let me know. Thank you.